All right, welcome everybody. This is Dr. Owen from Columbus Chiropractic and Rehabilitation Center. I wanted to go over just some therapies that we use in the clinic. We don't sort of have just one tool for everybody. We've got a lot of therapies, and so we wanted to take some time just to sort of explain to you guys, what therapies we use and maybe a little bit on how we might use them. Today I'm going to go over what's called active release technique, which is a really powerful tool that we use to treat soft tissue dysfunction. By soft tissue, I mean muscles, ligaments, and even tendons, maybe something called fascia you might have heard of. And those are involved in a lot of movement-based injuries, and we treat a lot of that here in the clinic. What we really like about active release technique is that it's kind of movement-based. That's not to say that we don't do trigger point therapy or other passive manual techniques like trigger point work or even just some compression kind of stuff. But we like ART because it's actually going to promote lengthening of that muscle and improve or at least restore full functional range to a muscle or a joint. Oftentimes it's that loss of range or loss of function in that muscle that produces the pain or the dysfunction that we're seeing in the patients. So what we do with that is we're actually going to start with the muscle in a relatively shortened position, and then the patient's going to actively lengthen that muscle while we are taking a therapeutic contact on whichever structure we want to work. And as they go through the range of motion, we're going to be paying attention specifically to what's going on underneath our hands so that we can tailor the therapy directly to that patient, right? So it's not just a general stretch, it's very highly specific to the patient themselves. If we were to use, let's say, the wrist flexors, like we're treating tennis elbow or golfer's elbow, it would look kind of like this. So Kelly would have her, she's going to make a fist. She's going to have her elbow bent. That's shortening that muscle all the way down. I'm then just going to take a gentle therapeutic contact, and when she straightens her elbow out and then opens her hand, that muscle is lengthening and stretching out. Now, as I'm going through this, I can actually feel which parts of the muscle are getting tight, and I can tailor the therapy and tailor my pressure to be more specific to what Kelly needs or whatever patient might need. So we might do, 5 or 6 what we would call passes with this. So she would be here, we would take our contact, lengthen, and open this up here. Go through it again, and every time I'm trying to feel something slightly different and then work specifically in that direction to improve the efficacy of the therapy. If we have her kind of sit up and face this way, we can show one that's for the low back. So obviously we treat a lot of low back pain, a lot of low back injury here. And one of the things involved in low back stuff oftentimes is some dysfunction in the back muscles themselves. So we can use active release technique to actually treat that in addition to the McKenzie method we might use or joint manipulation or mobilization or whatever. So if we're going to show this, we'd have her hands crossed right there on her shoulders. I can then lean her to the left. I'm going to take my contact here and apply a little bit of pressure onto those muscles, and then she's going to actively lean to the right. Now, while I'm going through and doing this, again, I can feel the muscles of her back lengthening underneath my thumb, and I can vary the pressure and vary the direction that my thumb is working in to be more specific to her to address the tissue that needs it. So again, that is active release technique. You can look up activereleasetechnique.com. You can also see stuff on our website, columbuscrc.com. But this is a really powerful therapy that we use to treat soft tissue dysfunction. And we're going to mix that with joint mobilization or manipulation that we'll go over later, with some active rehab like dynamic neuromuscular stabilization or tons of other tools that we use. So hopefully that was informative. If you have any questions, comment below and we'll be glad to help you out.